Good morning, everyone. My name is Craig Thompson. I am the Channel Marketing Manager here at Wavelink, and welcome to our online Info-Byte series. For those of you this is the first Info-Byte you've joined, these are bite-sized sessions designed for our community to give them a deeper understanding of the products we showcase and the key solutions we think businesses need moving forward as we steer ourselves to a new normal. In today's session, we're lucky enough to be facilitated by our health practice lead, Alan Stocker, who will be presenting Wavelink's vision for connected health, a term that has become a tentpole for our team when discussing how technology can enable and empower healthcare facilities. Alan has over 10 years experience in healthcare and IT and joined Wavelink in 2018. And for anyone who's met him at any of our expos that we've attended knows his true passion for the industry. Now, this is a session where we strongly encourage engagement. So please enter any questions you have in the chat box throughout today's event, and Alan will answer them in a Q&A following his keynote presentation. We'll also be recording this session, and we'll share a link after the event for you to circulate with your teams and anyone else you think needs to see it. We also encourage you to provide any feedback you have in the session via a feedback form that we will also send post the event. And finally, we also ask that you keep yourself muted, and there's no need for video either. For more information on our other events coming up, I welcome you to visit our website via the link I've placed in the chat box. And with that being said, Alan, it's over to you. Enjoy the presentation, guys.
Good morning, everyone. Thank you very much, Craig, for that wonderful introduction. So I'm Alan Stocker. I'm the health practice lead for Wavelink, and today I'm going to be talking to you about our vision for delivering on the vision of connected health. So I'm going to start off. Most of you know Wavelink very well, but just a very quick overview. So as you know, Wavelink is a technology distributor. We've got over 20 years of experience. We actually have two divisions to our business now. So we have our distributor run rate business, and we have the enterprise team, which I'm a part of. Within enterprise, we've got two sectors now. So we've got security, which is our Fortinet business, and we have the connected health practice, which I look after. Within the connected health practice, our key vendors are SpectraLink, who we've represented for the past 20 years, Alinkwa, Spoke, and SOTI. So a little bit about me, not too much, because you'll probably find this is the most uninteresting part of the presentation, but I've been, as Craig said, working in healthcare IT for the last 12 years. I did join Wavelink in 2018. A bit more about my role. So what I do on a weekly basis. My role is high touch. So I go out and meet with hospitals, mostly public health sector across Australia, and I tend to focus on C-level suites, so within clinical, so clinical C-suite. So that's more along the lines of chief nursing informatics officers, chief nursing officers, staff that have got a bit of a mix of an IT and a medical background. I visit those customers for numerous reasons, but I do presentations with them, I do workshops, I do solution demos, with the main aim of establishing their communication pain points and then identifying the best solutions to meet those pain points. The accounts that I work with are probably a handful of across Australia. And the reason for that is I'm often engaging with multiple stakeholders within that account and really immersing myself within that customer. So I'm seen as a trusted advisor. The ultimate gain of that, of course, is to sell that customer solutions. All of the solutions that get sold as a result of my work are sold through channel. So whether that be via tenders and the resulting contracts that come out of those tenders, so everything is sold therefore exclusively through channel. It's my job to drive up the demand for those solutions. Quite often I go out to customers with channel partners as well, and some of you that are even on this call I've been out to do customer visits with. So I do a lot of work with our channel sales director, Nick Tuzo, and we identify key partners that I can go out and do joint visits to end customers with. So today in this presentation, I'm not going to get into products. If you want to know the products behind this, we can set up sessions and go into product demonstrations and product slides later on. But today is more me talking around this concept of what is connected health. And to do that, I'm going to first of all talk about what unconnected health looks like. So you can see this very messy slide here on the screen. What I'm trying to illustrate here is that hospitals have multiple systems that they have to operate to run a facility. These are everything from building management systems, that are monitoring various systems within the building, the air conditioning, the elevators, the temperature. They have medical equipment that monitor patients. They have nurse call systems that trigger assistance and medical emergency alarms. They have duress systems that protect the staff, fire alarm systems. Often all of these systems operate within their siloed world, so not interconnected with each other. In addition to these systems, they then have various emergency codes. Each of those emergency codes have different workflows and a required team of respondents. Most of these alarms or sources of alarms, they're either alerted locally, i.e. if it's a medical device, the medical device will alarm, or it's done manually via, if you see the center of the screen there, we've got a busy looking switchboard operator, and it'll be their job to communicate the alarms out to the various team members that are required to respond. What I see as I visit multiple hospitals is that the communication methods currently used today are often outdated and they're noisy, they're distorted, such as overhead paging, two-way radios, annunciators, or even the operator having to sit there and place individual voice calls. With the pages and the overhead annunciators, it's one way. So you're sending a blast to a wide audience, communicating that there's an alarm, and you're not knowing who's responding or where they are. The overhead paging is also very disconcerting for patients that are in the hospital. If they're hearing that there's a cardiac arrest alarm in the area that they're staying, that can be very uncomfortable. With these outdated communication tools, they don't know who's received, who's responded. There's no escalation trail. What I see as I visit these hospitals is staff have to even carry multiple devices to respond to alarms. So for instance, if I'm a nurse and I'm part of a Met Call team, I've got to carry a pager for the Met Call team. Any other teams that I'm also a member of, I have to carry multiple pages. And quite often, I think one hospital here in Melbourne, I saw a nurse unit manager with 5 devices, and they were carrying, there's a pager, the scanner, a wireless phone, and a two-way radio, and a smartphone in order to do their job. Obviously, this is not ideal. So one of the first things that we do with the connected health vision is to consolidate devices so that staff do not have to walk around with 5 devices in order to do their job. So we look to incorporate a single smart device that's purpose-built for healthcare and is multifunction. So has the function of the other devices I mentioned: pager, two-way radio, scanner. On top of that, then we implement a connected health platform. Now that connected health platform connects into all those different alarm sources and processes within the hospital. What we're able to do then is to have a purpose-built application on a smart device where we can access all of the different information from all of those alarm sources from across the hospital. Now these devices, these purpose-built devices are generally shared, so we need to make sure that they're secured So we have applications that we run on the device to secure them. So if the device leaves the hospital, it becomes unusable. And the concept of being able to share them as well. So the ability for staff members to sign in and sign out of these devices, typically with tapping a staff ID on the back of the device, so that you can pass a device from one staff member to another, and it will be as if they were carrying their own personal smart device. So let's have a little deeper look at what the connected health platform actually looks like and does. So we have our multiple alarm sources, like I showed you on the previous page. And on the left, we can see here examples of those different alarm sources. So, I showed you on the previous page, we've got medical devices, we've got nurse call systems, BMS, integration into telephony platforms. Now, the communication platform also then includes an application for staff that can be accessed from a phone or a PC. And depending upon the severity of the alarm, we can then categorize into either tasks, incidents, or messages. On top of that, we can pull in additional integrations, such as here for tracking location of medical equipment or access to patient information. So an example of what that application can look like, the connected health platform within a hospital, and you can see here what it can look like in the center on a desktop, what it can look like on the right on a smart device. It enables us to do things like locate assets within a hospital, look at data from multiple systems. This is the digital twin concept. So rather than having to log into my BMS, rather than having to log into the nurse call system and all these other alarm sources, see everything in one single pane of glass, access to all of that data. So things like full contextual information of the alarms, where they are, what phase they're in, who's responding, and even things like with the integration into the RTLS system within a hospital, who is the closest to an alarm and therefore is best placed to respond. So what I'm going to do today is run through 3 scenarios: medical emergency, medical device alarm, and clinical consult. I'm going to show you what the process looks like in the unconnected health world today for a hospital that doesn't have this solution, and how by adopting this connected health concept that we can help improve that process. So I'm going to dive into the first one, which is the medical emergency. So in this scenario, we have a patient that is going into cardiac arrest, and within hospitals, they have, if you look at a staff member's ID badge, on the back of all their badges, they have this list of codes. Some of them are medical, some of them are non-medical, but it identifies when someone's having a cardiac arrest, that's a medical emergency, that's a code blue. Watching medical TV shows, you might have often heard the phrase call a code. So that's what they have to do when someone's having a cardiac arrest. It's call a code. So someone going to a telephone and manually picking up the phone, they would be calling the switchboard operator within the hospital. They then have to relay the information. We have a code. It's a code blue. This is the location of the code. That switchboard operator will then send out a one-way page that goes out to the code blue response team. So this is the people that we need to come in and respond and assist with this code blue. The limitations of this, obviously, you've got the people that are busy there trying to treat the patient. One of them's got to remove themselves from that situation, find the phone, call the operator, manually talk through the information what's required, and then the operator has got to type that out into a screen. It gets sent out to the response teams on a pager. Now, paging is one way, so that goes out to a pager, and then it's just a matter of everyone sitting and hoping and waiting that someone responds. You don't know where they are, how long they're going to take, or even if they've received that message or not. So in the connected health world, the way we're able to help streamline this process is when a patient does go into cardiac arrest, we can integrate into the nurse call systems. And this is an example of what a nurse call system looks like within an emergency department. They actually have some dedicated buttons where they can call a code directly from the nurse call system. So they don't have to call the operator in this case. They simply press the code blue button, which is right next to the bed. That comes into the integrated connected health platform where it hits, and you can see the view that it hits on a desktop on the left, on a mobile device on the bottom right, and they get full contextual information around that code. So they can see everyone else who has been sent that alarm. And if you see on the smartphone here where that alarm is received, as I receive that code alarm, it says, "Are you participating?" So that's two-way communication. So I can say, yes, I am communicating in this incident. And then either from the desktop or from the mobile device, I can see everyone else that has accepted that code. So I know who's on the way. And even if we want to see the location of the people that are attending, so we want to know how far they are, as we can see as they're converging on the source of that code alarm. We can see the participant view here. So again, a green icon next to those that are responding. And even things like when their code is over, how they communicate within the hospital that code is now clear. From the device itself, we can clear it down. So you can't do any of this with a paging system. So the ability to stand down the code, to let everyone know that this event is over. So anyone that may not have arrived yet, letting them know it's okay, this event has been resolved. Be able to clear it out when it's done, and then a full audit trail after this event, so knowing what time the code alarm was initiated, who it was sent out to, who responded, being able to escalate out to other staff members so that you have backups. If one person says, "No, I'm busy, I can't respond," and declines, the system can then immediately start hunting for other responders who can help with this situation. All right, so that's the first scenario done with. Now I'm going to move on and talk about another scenario that I actually have personal experience with, medical device alarm. So for anyone like me that's been unfortunate enough to be in hospital and connected up to a bunch of medical devices, these machines, infusion pumps, ventilators, patient monitors, they are constantly alarming. And it can be very disconcerting if you're a patient. And sometimes the machine's alarming because you've tangled up the wires by turning over in bed the wrong way. Sometimes it's a legitimate reason, like the medication could be running out in the infusion pump and needs to be replaced. But it's a constant disturbance for patients that are trying to recover. And in most cases, these machines are not connected to any sort of centralized monitoring that can alert the nurse that there's an alarm going off with this particular machine. So the usual process of what happens is the machine will start alarming. If there's no nurse in the room at that time, they won't be responding to it. And it typically relies on the patient to then realize that the machine they're hooked up to is alarming, and then to activate a nurse call. So at the nurse's station, then a little light comes up and a little bell is sounded on an annunciator to say that a patient in this room has requested for assistance. They don't know why that patient has activated the nurse call. All they know is the nurse call has been activated. So the first thing the nurse needs to do then is to attend the room and to find out what the problem is. So in this case, the nurse comes into the room, asks the patient what's wrong. The patient will say, "Well, this machine next to me is alarming." The nurse will investigate and then discovers that medication needs to be replaced in the infusion pump. So then the nurse has got to go away again, go to the drug fridge, find the medication from storage, come back, hook up the new IV bag, and reset the alarm on the machine. And this is something that I personally gone through when I was in the hospital and on multiple IVs, is that this would happen on average about every 30, 40 minutes. I was trying to sleep, trying to recover. The machine would keep on constantly alarming. It would wake me up. The nurse wouldn't hear it because they'd be off at the nurse station, which was quite far from my room. So I'd be constantly having to wake up, press the nurse call alarm, wait for them to come to my room so that I could get them to reset the system once again. In the connected health world, what we're able to do is something called alarm surveillance, which is all of these various bedside medical devices can be connected to the connected health platform. So rather than having the machines alarm locally and disturb not only the patient that's hooked up to them, but also other patients that might be in that room as well, because these alarms can be very noisy, is to have that alarm sent out to a mobile device, giving the staff member as well full contextual information around that alarm. Unlike the nurse call system that just tells you the patient needs help, you can get an alarm come through to the mobile device telling you that the IV medication is running low and needs to be replaced. And we can do this with multiple types of bedside medical devices. So that can be infusion pumps, it can be patient monitors, even more advanced systems where we can capture things like you see here on the screen. We've got the live feeds directly from that monitor. One of the key things with healthcare treatment is being able to proactively respond rather than waiting for someone to go into full-blown alarm. So with alarm surveillance, we can do things like look at a patient's blood pressure, look at their heart rate, look at their oxygen saturation level, and even predict if we think that they might on a deteriorating pattern, so that if no one does anything about this, in half an hour from now, that patient is going to be in deep trouble. These intelligent systems can predict this, and even then alert medical teams to let them know, it's called an early warning score. This patient is deteriorating. You need to intervene now before the situation gets a lot worse. All right, the final scenario which I'm going to run through is the clinical console. So in this scenario, we've got a patient that's in a hospital bed. They're in pain, so they're going to activate their nurse call. The nurse is going to come into the room, ask them what they want, and the patient's going to say, "I'm in pain." They'll be asked typically what their pain score is, and the nurse is then going to look at a care board. You generally find this up on the wall in the patient rooms. It's manually written data, typically, that will tell you, who the doctor is for that patient. So the nurse quite often is not able to just give that patient the pain medication. They've got to get approval from the doctor that's got full access to that patient's medical information, knows what other tablets they're on or other medications, knows exactly what dosage of pain medication they can have, how often they're allowed to have it. So in this scenario, the doctor has to be consulted. So the nurse will look at the care board, see who the current doctor is. The nurse would then call up the switchboard and ask them where the doctor is, and the switchboard might say the doctor's currently doing the rounds. Can you send a page to the doctor? So the nurse would then send out a page to the doctor. And again, as I showed you in the example before, this is one way. So the nurse and the patient in this situation are just going to be simply waiting for the doctor to call that nurse back to give the approval to administer medication. And if the doctor's busy and unable to get to the phone, this can be a lengthy wait, especially for a patient that's in pain and needs that medication. So in the connected health world, we go through the same scenario again. Patient complains of pain to a nurse. instead of having to leave the patient, and in this case, the nurse can simply take out a smart device and open up a clinical communications application without even having to look at a care board, can look at who is the current doctor assigned to the patient of the room that they're in. Initiate a what we call a patient-centric communications. So send a message to the doctor, so with the patient's name, in this case, David Edwards, with their patient identification number, and say, this message is in relation to this patient. And we engage in like a WhatsApp type of communication, but instead this is in a communications application that is purpose built for healthcare. So it sends a message saying, I've got your patient is in pain, score is 6, your patient is requesting for additional medication. The doctor then says, okay, I'll put an order into the EMR, which is the electronic medical record system approving the pain medication now. So the nurse can then say, okay, doctor, can let the patient know I've had a chat with the doctor, he's putting in an order now. The doctor, from their smart device, so would then simply be able to access that patient's record and put in an order for that medication. So authorizing the nurse to administer that medication. So in this case, selecting the dosage, how it's to be administered, approving that order, then sending a message back to the nurse to say, order is in, please administer that medication. What we're able to do here now with these smart devices is that the nurse will go away, get the medication to administer, but every patient has a wristband that has a barcode on it. And so we're able to integrate into the electronic medical record system, where the nurse will in fact scan the patient and then it will scan the medication, and it will verify that within the electronic medical record system, that will ensure that that nurse is administering the correct medication and the correct dosage to the correct patient. Now, this is a communication issue that can happen and does happen very often within healthcare facilities where people are busy, mistakes happen, patients get administered the wrong drugs or the wrong dosage, and that can have severe consequences. So this is, if you like, a checkpoint where the system will know if you're trying to give the wrong drug or the wrong dosage to the medication. So in this case, the nurse will scan that in, it will get a confirmation that that is now infusing that medication, and that will be logged within that patient's medical record. So if the patient were to ask again, 30 minutes later, I'm still in more pain, it wouldn't actually let the nurse administer any further medication because the system would know that they'd had their last dosage 30 minutes ago. That concludes my scenarios for today. If any of you on the call would like to know more information around the solutions that are behind this, that allow us to accomplish this, and how we put together different vendors to achieve this, or even go into demonstrations, I'd be happy to explore that with you. But today I really wanted to do it at a higher level and talk about the concept and just 3 common scenarios on this. My contact information is here. But what I will do at this point is turn back over to Craig and see if anyone has any questions that they'd like me to ask.
Yeah, thank you very much, Alan. So yeah, guys, please put any questions you do have into the chat box. So we have one from Bruno Lima. Is there any AI technology working together with the connected health system?
So yeah, there are. I have seen AI technology specifically around the predictions of future conditions of patients. Not one that there are some that we're exploring of working with at the moment as we look at new vendors to bring into complement. One that I've got experience in the past is Watson from IBM, which is a very powerful AI tool that can help predict even weeks in advance that a patient might deteriorate and be able to treat before they become symptomatic or before it's too late.
Cool. I know I've got a question while some people put some other ones through. Alan, I know that you talk to a lot of people, both on the retailer side and then obviously on our customer side, so actual facilities. Can you provide any kind of success stories that you're seeing from people that have implemented a connected health solution in any way?
Yeah, sure. So there's a couple of very big customers that I worked with in the last year where one very large hospital here in Melbourne that is currently rolling out about 1,000 devices with a connected health platform, and they had the same issue I mentioned earlier on. They had nurse unit managers that had up to 5 devices. The devices they had were outdated, and going and visiting the staff members on the ward after they've adopted that solution, and just them giving me feedback of how easy it has become for them to communicate now, that they don't have to leave patients' rooms. And this particular ward was a children's ward, and the fact that they could spend more time with the kids, they could treat them at the bedside if they needed help. They had a device there that enabled them to communicate with the right staff members that they needed effectively, and just treat patients quicker and be able to do their job much more effectively.
Awesome, cool. And while I've asked that question, we've got 2 more that's come through, which is great. So the first question is, what happens if the doctor, and I guess we can open this up to what happens if the staff member that's being called or triggered as part of the process flow is out of the hospital, and if they're not available, what's the process then? What happens?
That's a really good question. So the system has a database of all of the staff members within their facility, and it has something within there which we call determined as on-call. So it could be I came into the hospital earlier on today, and one particular doctor authorized treatment for me. Then that doctor goes home. The system knows at any one time who is the attending physician and who is on call. So the system will first of all try and reach the current on-call physician. If they don't respond within a certain amount of time, what we build into the workflows is then the backup personnel. So the system will then say, okay, who else is on call? Who else can I reach out to help with this particular issue? So it will then hunt down, and it will escalate until it finds someone that can respond.
Cool. And then one other final question is, do the nurses or the staff need to enter any kind of password to access the apps on the mobile, or is there any kind of factor authentication? Bruno, would just like to get an understanding as to how quickly the nurses can respond once they're called upon to act.
It depends upon the policy of the hospital. So like I said earlier on, they can tap on to sign into the devices with a staff ID. The applications themselves, sometimes the hospital will require that each time they open an application that they enter in their user credentials, or that they have some other type of authentication like fingerprint or facial recognition. Typically with most customers that I'm working with, they just tap in and log in once at the start of their shift with their staff ID. And then all of the applications remain open so that they don't have to put in a password every time they need to access an app. Then at the end of their shift, they'll tap to sign out of that device. The other thing we're able to do as well, though, is we can be quite location centric with that. So if that device leaves the hospital, we can close down access to all of those applications. So one of the important factors here is security. We don't want anyone else getting their hands on that device and getting access to potential sensitive patient information.
Awesome. Thank you very much, Alan. If there is no other questions, we will leave it there. What will happen is following this session, we will send out, like I said, a recording of the session that you can share around. You'll also have Alan's details directly, as well as access to the slides. With that being said, thank you very much for joining on behalf of Alan, myself, and Wavelink, and we hope to see you at another one of our Info-Byte series very soon.
Thank you very much, everyone.
Thanks, guys.